You found me for co-host Sastry.
Disorders, and it can lead to depression and anxiety, more likely sleep disturbances. So it is very difficult for it creates you fatigue and other difficulty problem and concentration. So G lymphatic system, what we call, right? What we call G lymphatic system. G lymphatic system. G lymphatic is a drainage of the waste from the brain. So because of the sleep disturbance, you suffer from what? Pain problem, but this pain leads to Parkinson, Alzheimer's, cerebral atrophy. Yeah. So one problem leads to other problem, and more important is the emotional distress. So the person is having lot of irritability, lack of confidence, and this is all on neural basis. The behavior changes on neural basis, right? It changes on neural basis. Social isolation. So these people limit to social interactions and participation. They don't want to talk to the people. And that is why in our institute we encourage the social participation. Any this problem, patient thinks that he is the great patient and no one is more sick than him. And because of his own irritation, the dopamine level, serotonin, acetylcholine, all this generates. But also it also has a chances that if you go in a chronic situation, you may also have comorbidities like myasthenia gravis. So in many cases we have found myasthenia gravis comes from chronic pain due to stress. Chronic impairment, you can understand memory and decision making is one of the most difficult things you'll find in this type of patients. Right? So here you will see depression, anxiety, and pain perception. So here you will see depression, anxiety, and pain perception. So higher is individual with chronic pain are at 30% risk of developing depression. It is more than 30% of the people who are having this pain are in depressed stage because of the neurochemical imbalance. Because of what? Neuro, Ayorama. Neurochemical transmitters. So there is oxidative stress. This oxidative stress leads to what? Higher stage of depression. So the happy hormones are upset. Those who are working pain management, they should understand these people do suffer from higher stage of depression, lack of confidence. So they are not able to concentrate on that treatment. If you say them to come for 20 days, they will only come for 5 days. Then they will say, "Farak hi nahi par raha, ye nahi ho raha, you are not getting change, you are not getting recovered, blah, 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 Lakshya will speak." So And then it gets to anxiety disorders. Why anxiety disorders? Because of uncertainty. They have uncertainty. Thinking. What is anxiety? Thinking about uncertain things. They will feel that they will never recover. Insecurity. Acuity. The acuity of pain leads to insecurity. Right? So generally we give them what? Tryptomer with other medicines. So it becomes some relief, but otherwise, in acupuncture we give pieces. Acupuncture we give PC6, heart 7, liver 3, ST36, GB34, liver 2, VL64. These are the additional points which we give. And definitely they have a very important role in recovery of the patient. Li4 is most important in recovery of the disease. Li4, Li11. Am I clear?
Yes, sir.
In NIPS, weak muscles. 1, 2, 3, 4. 1, 2, 3, 4. Anxiety and depression will reduce in 10 days. Am I clear?
Yes, sir.
Yes, sir.
Namrit Basa, you wanted to come to Hyderabad, you can come, right? Just talk to Sandeep and you can come. Right? Those who have purchased paint, as per their plan, they can come. I will teach you individually also. No need to worry about the group and make them come. Just see that I am having that time dedicated to you, right? Ask Sandeep because I don't know about my problems. Chronic pain can lead to negative thoughts. We all know, such as cataphasia, exaggerating the severity of pain. So this type of patients you will often see in overgeneralization, as in pain will be always be present. So these people will be always saying, nothing is happening and then eliminating to be functional. So all these things are the cognitive disorders you will find in this type of people. Behavior changes. Chronic people can lead to avoid behavior such as limiting physical activity, social interaction. They can result to social isolation, decreased quality of life, which we have decreased further. And they are attention seekers. Most important is they are attention seekers. There are two categories. One will continue to suffer. Other and higher depression. One attention seekers. So CBT is also cognitive behavior therapy or psychotherapy is a part. Generally, socialization is one of the part which we adopt here in the recovery of the patient. So whenever you see behavioral changes, NIBS 2 and 4, middle finger. So behavior will what? Anxiety, neurosis, depression, all will come down with the improvement in pain factors. Endorphin, enkephalins will induce. So middle finger at 20 degree and 40 degree. Sachin, you understood? Sachin? You understood? You can try on your patients. We have done it. We got good results. 20 and 40 means second degree pain and 40 degree pain. That is why we say purchase of 7 pain is required. So neuromodulation therapy is our non-invasive. Walid, start taking attendance from today onwards, right? So everyone who was in the class, write their name and country first. Whoever is in the class, name the name and country first. Walid, start taking attendance. Walid, can you hear me? Walid? So, neuromodulation is done by transmagnetic stimulation, we told you. So, we have developed this part into NIBS and brain mapping. So, whatever you are doing, you have developed one machine which is 5 crore rupees machine and 2 crore rupees license every year into a very simple procedure of non-invasive brain stimulation with continued brain mapping and updation. So you are getting every month you are getting updations. You are not paying anything extra for the license. You are not paying for anything, but it shows a promising result in elevating chronic pain by modulating the neural activity in specific brain region. That is called neuromodulation. So NIBS is very good for neuromodulation, right? In post surgery, if you see the pain is continuous and all these things are continuous, what you will do? Walid, are you there? Walid? Walid?
सर वालिद जी दिख नहीं रहे सर.
So I already told you, I have written a book on stem cell therapy. I have written a book on stem cell therapy, right? So I already told you that regenerative medicine plays a very important role in combination with plasma. So stem cell therapy with PRP in combination plays a very important role in paralysis, neuromuscular disorder, MND, and various neurological disorder, Parkinson's. That is why I say NIBS is sometimes not alone. A combination of all gives an effective result. Because they have the potential to repair the damaged tissues and promote the healing in patient with chronic pain. Right? They have the potential to damage. So quantitative sensory testing provides a mode of objective assessment of pain perception, enabling personalized treatment plans and treatment process. So especially NCV test and all, they help you to understand the electrodiagnostic, in which I have done my fellowship. I have done my fellowship in electrodiagnostic medicine, right? Right now, this fellowship is only given by two institutes. One is in Bengal Medical Center, America, and one is International Institute of Neuroscience. So I was the first one to do it in India.
ಏರ್ಪೇಡಿ ಅಡ್ರಲ್ಲಿ ಆಣಲ್ಲ ಜಾಸ್ತಿ
Breakfast Genesis और अभी तो কালকে বহুত কালকে খুব ভালো কালকে ডিপ স্লিপ হয়েছিল কালকে রাক্ষসরা সব শান্তি নিয়েছিল তো শান্তি নিয়েছিল বড় রাক্ষস মেরে মারলা আমি হচ্ছে ব্রহ্মা আমি হচ্ছে ব্রহ্মা হ্যাঁ
I already told you this is the 2012 paper, gene lymphatic system. Two people have published papers in this more directionally. One was published from Boston University by Negard, and the other was published by IP Chege. Right? There were two people who have published these papers, in which both was emphasized that CSF has a major role in curing the pain. Hello? Neuro Hospital, Hyderabad. Line katiye. Neuro Hospital, Hyderabad. The lymphatic system is recently discovered. It is not recently, it is discovered almost 12 years. Now you cannot call it recently discovered. It has gone more than 12 years. And before that, much before that, Cherian has said about the cleaning and cooling of the brain. So, cleaning, cooling, and maintaining the temperature of the brain was very important. So, we can understand there are two types of proteins, tau protein and amyloid beta proteins, which implicate the Alzheimer's disease. So, in substantia nigra and all, if the proteins are deposited, you suffer from what? Parkinson's. So, that is why I say use of BPAP machine, sleep clinic is very important to recover chronic conditions of the patient. If you just think painkillers, those methods are gone by which you will believe that painkillers can alone recover, but acupuncture can alone recover. This is the time of integration of the best treatment. Mayer's cocktail, on which I will teach you. Mayer's cocktail. Right? It's a combination of vitamin. So, research revealing that disruptions in the system often associated with aging and neurodegenerative disease can contribute to the accumulation of toxic substances leading to impaired brain functions and neurodegeneration. I already told you the deposition of protein inside the brain may lead to neurodegeneration. That is why NIBS plays an important role. Again, it induces what? The lymphatic system. So it helps you for the protection of Alzheimer's in chronic brain condition. So whenever you use NIBS, you understand that it is a preventive treatment, recovery treatment, supportive treatment, and continuous treatment without side effects. So most important part is what? It is a supportive, continuous, and recovery treatment. That is why it is said NIBS will play a major role in coming future. But RTCMS is a machine which is very difficult to buy. And number two, the NIBS is non-liver toxic and non-renal compromise. There is no renal compromise here. There is no side effect in the renal side. Rather, this treatment supports the patient in the long run, sustainable, and the patient whom we have treated long back is still without pain. So that is the most important reason when we treat this type of disease, we have to understand the mechanism of the lymphatic system and all this system. And its role in the neurodegenerative disease. Because we know that CSF, which is deposited in the supracellular system, releases what?
ইয়ে করো এটা ওইরকম নিয়ে যাও মুখটা মুছো
Bacillomyces
এটা
colon, this mucomytomyo, others. You understood G lymphatic system is a process by which we'll take a very beautiful class on G lymphatic system. Once you understand the G lymphatic and NIBS and pain procedure, you will find that pain is just a beautiful game. And then you can think that yes, you can really recover the pain in various disorders. Varun, mic mute karo.
भगवान से की भक्ति
So that is why I say, if you try to recover something, neither you will get any satisfaction. Anything if you get use, no use. Because until unless the practical part is known, you will not get. And as soon as you give me your name, maybe tomorrow, day after tomorrow, you'll get a certificate from Karat.
Thank you, sir.
Because you are the only one who was very sincere, attentive, and from very 7 months you have been continuously learning, 9 months. Almost you have completed 1 year with me in this December. So, because of all your sincerity and dedication and your learning, you obtained this fellowship. And your thesis writing will help you to complete your thesis and paper publication. So, it will be a provisional, but then also you got the fellowship. We have cleared all the substance material for international fellowship class. You are the first one in the batch to clear it.
Thank you, sir.
We already told you about stem cell therapy. This is called mesenchymal stem cell therapy. Ayodam.
Stem-
This called stem cell therapy. We already told you. I think I have taken this class. Yes. Yes. So gene therapy involves introducing genetic material into the cells to repair the replacement faculty of genes, potentially leading to long-term pain relief. But this is very costly material and it still is in early stages. Therapy was promised for treating chronic pains and targeting specific genes. So it is altering the pain pathways, but then it is very costly. PRP is one of the cheapest one. We have to teach you very closely what the PRP and stem cell therapies. These are the promising things which you have to result, learn, and proceed. With NIBS, stem cell therapy, PRP, all this if you learn, you are in the next level of your learning. नाम लिख के दे देगा सुनील तुम हाँ
Yes, sir.
So when we speak about the stem cell therapy, what are the types of mesenchymal stem cells? MNCs are the multipotent stem cells found in various tissues, including bone marrow. So this is the place from where we take the stem cells and adipose tissue. So adipose tissue was taken by H.K. Dwivedi. Dwivedi sir was the first one to replace kidney transplant without giving any immunosuppressants. So most of the kidney transplants become failure because of the immunosuppressants. So H.L. Dwivedi, who established Padma Vibhushan, Dr. H.L. Dwivedi, Lesh Dwivedi, may his soul in peace, the great divinity, has done a very wonderful job in stem cell therapy and kidney transplant. After him, no one was able to do it. He studied in Canada. He came to study in India and he established the biggest kidney hospital in Ahmedabad. You can read in internet about H.L. Dwivedi. It's Trivedi or Dwivedi, I don't remember exactly. My book is also dedicated to that great person, his love for his subject. So he was the person who brought stem cell into main line of treatment in kidney transplant. I work in large number of cases of paralysis, hemorrhagic stroke, spinal cord injury, neuropathy changes. Even in cancer therapies, I have worked and I found very good results in both the cases. When in stage 4 cancer, we found that yes, it is very supportive, recovery level, quality of life, everything is very good in this. So neurostem cells are found in the brain and spinal cord. So we use it in what? This we use in what? MND disease. MND disease. Anterior horn cells. Basilar artery infarct. Stems have been investigated for a wide range of conditions, including spinal cord injuries, osteoarthritis, and neurodegenerative disorders, including neuromuscular disorders. So they are identified for what? Neuromuscular disorders. Clear?
Yes, sir.
So it is MNC, NSC, and omnipotent. So they are one type of cell, multipotent cells, and neural stem cells. So we will teach you those who are competent. We'll again teach you how to take out, how to harvest stem cell therapy and all. These are the part of the syllabus. Uh, uh, why it is not going to the next slide? Okay. Hello. Hello. So I already told you about plasma-rich stem cell therapy. It is a very good procedure which you take out from the blood and you centrifuge in the concentrated platelets. It's one of the very beautiful therapy right now recognized by orthopedic physicians and everyone. And it is given from the own blood, which is drawn and centrifuge and concentrated platelets are given in certain locations. The PRP is then injected into the injured area, aiming to stimulate the healing and tissue regeneration. Even in avascular necrosis, what you call uh, frozen shoulder, and all these things they are given. But if you say, if I give today, tomorrow you will get the results, it is not like that. PRP is one of the very good pattern in which promote cell proliferations, tissue repair, and pain reduction is found. So PRP is a very good part. If you introduce it with NIPS, it is called Subhanallah. PS, neuroacupuncture, combined with TUM.
Yeah.
Fastest result. It is more faster than fentanyl. You can check the working time of fentanyl, which is 5 minutes. Here the time is less than 1 minute. So when I mean fentanyl, Maharashtra and all, you have to give 3 prescriptions. One prescription will be in the cash sheet, one will be the hospital, one will be the pharmacy, and then how much you have used, and rest the ampoule and other thing has to be deposited to the hospital, right? So you cannot use the fentanyl. But if you use NIBS, it is more powerful than fentanyl.
Okay.
Hello. Ah, yes. Neuro Hospital, Hyderabad. हाँ ठीक है, लाइन काटिए, लाइन काट दीजिए. हेलो. हाँ यस. आपको किससे बात करना है और क्या बात करना है? ये हॉस्पिटल का रिसेप्शन है, बताइए क्या बात करना है, क्या मेडिसिन चाहिए आपको? आप लाइन काटिए, आपका नंबर ब्लॉक करता है. फालतू बात करता है। So now you can understand basis of dermatome and myotome. Obviously, acupuncture has a very important role on the basis of dermatome and myotome. So various, you can see two, 3, 4, 5, S1. So foot drop and all can be very easily identified. The gluteus pain can be identified from this is the area where acupuncture points are located, from where the sciatica pain is traveled. So you can understand from here the sciatica pain is traveled, nerve impeached. So whichever nerve is impeached, for example, L4 is impeached, so the dermatome is up to here. So more often L4 pain you will find here. So if you find over here this pain, to understand, more of the time coccydynia is confused with what? Coccyx pain, but it is also associated with L2 disc degeneration, right? So L3 is here, L4 is little down, L5 is here, right? So it is called what? Dermatome and myotome. Dermatome is what? The muscle associated. Myotome is the nerve conduction. So that is why we say when you understand the dermatome myotome, it becomes very easy for you to recover paralysis patient. Hello. Yes. In Euro Hospital, Hyderabad. हाँ नहीं हैदराबाद में. Okay. I have become very famous in Punjab. I don't know how many calls I get from Punjab every day. The quantitative sensory testing definition, a standard set of tests the the standardized test of test used to measure a personalized sensitivity to different types of sensory stimuli, heat, cold, pressure, and pain. So whenever people speak of numbness, we go with what? QST, quantitative sensory testing. So this testing stabilizes what? QST speaks of, people say, na, I'm feeling numbness. Many patients who came in the camp, they said, I'm feeling numbness. So we went with what? Cold, pressure test. These are the what? Clinical tests for finding sensory deficit. QST helps in understanding underlying mechanism of pain. Right? It helps you to understand underlying mechanism of pain and identify the potential causes, monitoring the treatment and progress. Used in clinical practice to diagnose, classify pain disorders as well as to guide treatment and diseases. So most important is I have written one book, decision making in what spinal cord pathology of the spinal disease with Dr. Pawan Irigata, a neurosurgeon. I have written one book, steps taking in spinal disorders. And second book I am writing with Vati, decision making in pain treatment disorders. So this is very important part for you to understand that if you don't study it continuously, you will have what? You will get 0 mark in the exam. So you can understand only NIBS or acupuncture cannot recover. Multi-purpose therapy, even if acupuncture is not there, lot of things are there which can be included and patient will recover very fast. Recovery should be at a faster level, then only the confidence of the patient will move for your treatment. Otherwise, all is what? All is well. All is well means all is
ऑथेंटिक साइट है ना
gone.
हम्म
So generally we used NCV test for nerve conduction velocity test to understand. Clinical and nerve conduction velocity test helps you to quantitative sensory testing. So it helps you to
नंबर है
identify type of
आणि तो
stem cell
हा
therapy neuropathy mechanism. So someone is talking, please mute the mic. So
Yes, sir.
regenerative potential, we already said it helps a
स्क्रीनशॉट गेला स्क्रीनशॉटचा नंबर द्या रेफरन्स नंबर
hello. Hello. Can you hear me?
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir. You can hear you.
Now, if you see, again, there is a problem here. Non-invasive brain stimulation, we have converted to TDS, direct current stimulation. So our method is direct current stimulation, but we have used the map of NIBS. Hello. Hello. So we have the mapping of NIBS, entire nodes of NIBS are there, but we must know how to use different types of pain in different location. Different types of pain in different locations. So we have identified it to 1 to 9. The permutation of combination 2, 4, 6, 7, 1, 3, 5. All these are the shortcuts to understand NIBS. So by this we have hijacked this, what you call transmagnetic stimulation. So if you understand more actively, you can work in psychiatric diseases, paranoid disorders, schizophrenia, depressions, chronic depressions, pain disorders, paralysis, large neuromuscular disorders. So it's up to you how much you can learn and how much you can recover. Even you can recover in very good health in diabetes part. You can get, because we have tapped a lot of people who are there having what you call insulin dependency was there. So they were on human we start 70-30 and other long-acting, short-acting insulin was given to them. But with the help of NIBS, we were able to recover them and the pain perception was greatly reduced to these people. And so it offers a now you cannot call it alternative because painkiller is alternative mechanism now. There's a new definition. The painkiller is a side effect. Hello. Yes. Neuro hospital. Line cutting. That is why I say if you continuously practice in a proper way, you have practiced this type of instrument instead of using such type of costly devices. You must learn the process of neuroacupuncture and all because this is very cheap, best. And once you master these techniques, you can overcome Parkinson's by working on G lymphatic system. You can induce sleep. You can work at higher level. So the more you go higher, the higher you will learn. So if you want to see Everest, you have to climb Everest. So that is why I said NIBS is a very good module. You have to start working on it very nicely, perfectly, because it is not for one system. It is works in multiple ways, in multiple theories, multiple ways. So if you only calculate it on paralysis, it is not like that. It is for CP child also. It is for autism also. It is for large number of diseases. So it's up to you how much level you want to fight. The definition of work is defined by you, not by me. Because I'm only interested in what? Paralysis and all. So I take maximum this. But anyway, we take other problems also whenever required.
Yes, sir. Okay.
So I already told you this is cervical myelopathy and spinal surgeries. So cervical myelopathy is a cord compression, like OPLL and all. The cord compression is there, and there is edema in the cord, the loss of tissue, and altered sensation is there, by which the patient goes to quadriplegia. So myelopathy leads to hello.
Quadriplegic.
Hello. प्रणाम सर. बस सर हुक्म है आपका सर, बताइए सर. हाँ सर. तो उनको वो लैक्टोज दे रखे हैं, कल नहीं होगा तो सर वो दे देंगे, एनिमा दे देंगे. हाँ, क्योंकि सर वहां से भी उन्होंने मना किया था एनिमा देने के लिए. एनिमा शुड बी द लास्ट पार्ट. तो स्पाइन सर्जन ने मना किया था. तो वी आर वेटिंग कि लैक्टोज डबल दिया है डोज. एक्चुअली सर वो उसको वॉशरूम जाने के बाद भी वो कंप्लेन करती है सर. वो अटेंशन सीकर है सर. उसको तो क्या सर, बट आईसीयू से तो आज पहले दिन जो आप मिले थे, आज तो काफी बेहतर है सर. साइकोलॉजिकली स्टेबिलिटी तो काफी अच्छी है. ऑल स्टाफ. तो वो उल्टी सीधी बोलना भी बंद कर दिया, क्योंकि वो उससे बात करती है ना. तो हम लोगों ने तो सारी दवाएं ही विड्रॉ कर रखी है. अभी खाली अमाइनो एसिड, न्यूट्रिशनल सपोर्ट, विटामिन सी, ये सब दे रखा है. और रात को एक थोड़ा सा सेडेटिव दे देते कभी कभार जब परेशान होती है तो. वो मेटाजोलम में सब दे देते सर. बट अदरवाइज शी इज डूइंग गुड विद एक्यूपंक्चर एंड ऑल, एवरीथिंग शी इज डूइंग गुड. मेरे हिसाब से सर बस वो वरीडनेस, वो क्या है, वो थोड़ा डिपेंडेंसी खत्म हो जाएगी. एक साइकिल है बस. काफी हद तक तो टूट गया. मतलब जो आप टेंशन ले रहे थे, मैं जो टेंशन ले रहा था कि कंटिन्यूअसली कोई डैमेज नहीं हो जाए, ऐसा कुछ नहीं है सर. वी हैव ओवरकम साइकेट्रिक. ये सर. बट इनका कैसा थोड़ा ईसीजी ग्राफ की तरह है. वो जब तक आप उसको फुल अटेंशन देते रहेंगे हम लोग, तब तक तो ठीक है सर. थोड़ा सा अटेंशन कम हो गया तो उसको फोन करते, उसके रूम में अटेंड होना, उसको मिलना. हम लोगों ने आधे आधे घंटे में ड्यूटी लगा रखी है उसके लिए. नहीं सर, आप ही से सीखा है. अटेंड से सीकर को तो अटेंशन देना होगा. नो नो सर, वी हैव नो अदर ऑप्शन. अगर परिवार की तरफ सपोर्ट नहीं करेंगे तो फिर क्या फायदा. व्हाट इज माई यूज. फिर मैं आपके समधी कैसे होएगा सर. सुमित को तो सर यही बोल के वहां सारा सपोर्ट मिला कि शास्त्री जी का समधी है, का बेटा है, दामाद है, शास्त्री जी का दामाद है. वी गॉट ऑल द ऑफिस सपोर्ट फ्रॉम द डायरेक्टर्स ऑफिस. इंटरनेट से नेम से किसी को मिलता नहीं है, बट उसको मिला. बोला इसका वही नाम ही निकाल रखा, शास्त्री जी का वो समधी का बेटा है, दामाद है शास्त्री जी का. दामाद है। चेरियन ने इसका नाम ही निकाल रखा, शास्त्री जी का दामाद है इसलिए उपाय नहीं है। बियर हिम। सबको कंप्लेन कर रहे थे रामदास लोग इसकी, कि ऑफिस में बैठा रहता है, काम करता रहता है, ऑफिस इज नॉट मेंट फॉर हिम। तो फिर चेरियन ने नाम निकाल रखा है, शास्त्री जी का दामाद है। अब क्या करे बताओ, निकाल दें उसको, क्योंकि अभी इसको निकालेंगे तो फिर आपका भी पेशेंट आएगा, आपको भी तकलीफ होगी। बड़ा सर, सबसे ज्यादा कचरा वो रामदास है। तो वो पहले से ही ऐसा है क्या सर?
सर नहीं है भैया, सर आउट है शायद।
Yes, you are right, sir. Okay, sir. Anthony. Okay. Next time.